I feel very honoured to have been invited to join Anne Charlotte Gillenram, Cochlea Nordic and other friends for the 30-year celebrations for Barnplantorna. Barnplantorna has very successfully shown us how to take cochlear implant engineering, medicine and audiology to the classroom and daily lives of children. Thank you, Anne Charlotte, for your inspiring leadership. But when I first came to Stockholm in 1976 to learn about speech research at the Royal Institute of Technology, led by Professor Gunnar Fant, I could not have imagined that 45 years later, an organisation such as Barnplantorna would be celebrating 30 years reaching out to deaf children using a cochlear implant. In that period, I returned to Sweden and saw firsthand how Barnplantorna overcame many difficulties to achieve success. I came in 2006 as plenary speaker for the 37th mini-symposium at the Karolinska Institutet, and then in 2011 for the medal lecture from the Nobel Institute for Neurophysiology in honour of Ingvar Zotterman, a distinguished physiologist. My journey started when I was a 5-year-old. As I told my kindergarten teacher, when I grow up, I want to fix ears because my father is deaf and has trouble hearing customers in his pharmacy. Just how deafness had affected him, I only discovered when he was in his 90s, and I asked him what it had been like, and this is what he said.
It affects your whole life. It is nothing so embarrassing as not being able to hear people properly.
To further my aim, as a 10-year-old, I decided to be an ear surgeon, but I discovered we could not fix nerve deafness. This was also the view of a leading American auditory neuroscientist, Merle Lawrence, who said in 1964, direct stimulation of the auditory nerve fibers with resultant perception of speech is not feasible. These negative conclusions, however, lit a fire in my belly as I had a strong passion to do research. So I set out to find answers. With family, I left a specialist practice in Melbourne to be a PhD student in the Brain Research Unit at the Department of Physiology at the University of Sydney. I will not forget my experience in 1967 when I walked into the university's neurophysiology lab and I saw all the electronic equipment. I would have to learn to use them. Then I was overawed when I heard brain cells popping away in synchrony with the sound frequency.
When we sound a pure tone of appropriate frequency and intensity, this activity is increased.
But at the time, it was not clear how frequency was best coded and to what extent rate or place of excitation were important for electrical stimulation. But at the completion of my PhD studies in 1969, I had found what rate of stimulation would not transmit frequencies above 300 pulses per second. Place of stimulation would be required for speech understanding using multi-channel cochlear implants. However, I had nowhere to go to further this research until the University of Melbourne took a big risk in appointing me as the first professor of ENT in Australasia. There were many important questions to answer. For example, how could I pass a bundle of electrode wires around the tiny spiral of the inner ear to stimulate the brain for the place coding of frequency without it getting stuck? The answer came while resting on the beach. I saw a shell like the inner ear and found that grass blades that were flexible at the tip and stiffer at the base would pass easily. Then, on the 1st of August 1978, I operated with Brian Pyman on my first patient, Rod Saunders, at the I&E Hospital. The multi-channel electrode passed successfully around the inner ear. But afterwards, could we discover how to code speech sounds with electrical stimuli so they were understood? After 3 months of psychophysical studies, I had a eureka moment when Rod heard stimuli as vowels as well as pitch-like sounds.
It sounded like up, low, and dull. That's a very high F and sharp.
This was followed by discovering that the vowel perceived had a second and later first formant frequencies that corresponded to the site of excitation for those formants. That gave us the clue how to develop a speech code that presented the second formant F2 as place of stimulation. And in December, Rod heard speech sounds with electrical stimulation of his brain without the need to lip read. I was so moved, I went into the next door lab and burst into tears of joy. I knew then that all the blood, sweat and tears of the last 11 years had been worthwhile. We had done what many said was impossible. But the job was not yet complete. I had to see our discovery get out to the world and help hundreds of thousands of deaf people. This meant industrial development. But Australia had only one medtech company, the pacemaker firm Telectronics. Could they do something more complicated? Yes, they could. And with funding from the Commonwealth Government and much support from the University of Melbourne, the company did a fantastic job. Paul Traynor, the owner, created a tiger team which developed a beautifully engineered clinical trial device at lightning speed. Cochlea Limited, which had been created, then initiated a world trial in 1982, and I led the first phase of the clinical study in Melbourne to make sure it had been engineered to reproduce the results the university had obtained with our prototype device. In 1985, the implant became the first multi-channel implant to be approved as safe and effective for deaf adults by the US Food and Drug Administration. The implant was also modified for studies on deaf children. In 1985, with Rob Webb, I operated on our first child, Scott Smith, at the Iron Deer Hospital, and then in 1986 on our first young child, Bryn. In 1990, the FDA announced that the 22-channel cochlear implant was safe and enabled deaf children from ages 2 to 17 years to understand speech. It was thus the first cochlear implant of any type to be approved by a World Health Regulatory Body and the first advance in helping severely deaf children develop spoken language. Cochlea Limited has continued to work collaboratively with the University of Melbourne and other institutions to drive innovation, and this has led to the latest Nucleus 8 device. Our multi-channel cochlear implant has been a wonderful team effort between the health sciences, engineering and industry, and it is touching to recently learn the Graeme Clark Cochlear Implant Choir, formed in Spain, was invited to sing for the Pope in Rome. Finally, it is my hope that through basic and clinical research that people in need of rehabilitation will receive much needed help. But these dreams will only be fully realized through organizations such as Barnplantorna, which helps bring holistic healing to people with deafness. In conclusion, I would like to thank Anne Charlotte for her fellowship over many years and congratulate again Barnplantorna on what you have achieved and wish you great success for the future.